official spokesperson and public relations officer of PGIMER Chandigar. My study is public grievances, patient feedback to the healthcare system in a premier hospital of North India. Yeah, the grievance. What is the grievance? This paper understands grievance as a reason for complaining of being unhappy with a situation. Public grievance and redressal system is such a huge hospital, is a psychological tool to improve the functioning through feedback of large number of patients visiting PGIMER. Now the objectives were to identify and explain written grievances put in by aggrieved patients, their attendants and others. To identify and analyze psychological traits that motivate the aggrieved persons to file grievances. To recommend steps to be taken by hospital authorities to address grievances. The methodology used was the research method used to analyze written grievances is qualitative content analysis. Unit of analysis is single written complaint. The sample consists of 25 randomly chosen written grievances put in by patients, attendants, and others in the last 10 years. Now look at the patient rush in the last 10 years. It has increased from about 12 lakh to 25 lakh in the OPDs, and in the indoors it is from 5 lakh to nearly 8 lakh. And the hospital stats of 15-16 are number of beds 2000, OPD patients 24 lakh 23,501, indoor patients 87,973, major surgeries 43,373, and minor surgeries 1,62,021. Now, hospital staff that copes with the rush, faculty of 400, resident doctors are 1,200, nurses 2,000, technologists 700, security 600, and hospital attendants 1,000. There is a committee for public grievances and redressal. Chairperson is a senior professor. Members are senior faculty from Department of Hospital Administration, General Surgery, Internal Medicine, and Gynecology. And convener is the public relations officer. And these are collected through complaint boxes, official website of the institute, letters by hand, and government web portal. And what are the types? The types of grievances are misbehavior and carelessness by different types of staff, wrong treatment, overcharging and rude behavior by chemists, long queues at the registration and fee counters, and lack of sufficient amenities according to the complainants. Now the psychological factors used are heuristics and judgments, cognitive bias, mental noise, cognitive distortion, and cold bias. Heuristics are simple, efficient rules used to make judgments and reach decisions. These are mental shortcuts that focus on one aspect of a complex problem while ignoring others. May lead to systematic deviations from logic, and these are used with limited information, thus leading to intuitive judgments. Cognitive bias may lead to irrational decisions. Patients and their attendants draw inferences about doctors, nurses, and the OPD environment in an illogical fashion by creating their own subject social reality. Distress is indicated in the intense words which point to perpetual distortion, illogical interpretation, bordering on irrationality. And mental noise, environment in which patients and attendants find themselves, seems to create mental noise, contributing to cognitive bias. Factors involved are emotional and moral motivation and social influence. Cognitive distortion is a type like blaming, jumping to conclusions, mislabeling, magnification, overgeneralization. Blaming is manifested in patient and attendants' grievances, which can also be understood as a part of cognitive distortion. This is especially the case of those who hold doctors, nurses, and official attendants to be causing emotional distress on account of perceived negligence on their part. Grievances of patients, attendants, particularly when expressed in black and white, make them perceive the hospital environment and their perceived handling by nurses and attendants as true. They jump to conclusions. Patients and attendants seem to exhibit another kind of cognitive distortion, namely jumping to conclusion. They appear to reach preliminary conclusions, mostly of the negative kind, based on limited evidence or experience of hospital environment. And there is mislabeling also. There is magnification, form of cognitive distortion wherein it can be observed that patients or attendants accord proportionately greater weight to perceived malfunctioning or neglect at the hands of hospital authorities or doctors or nurses. There is overgeneralization. Now, there are some cases. Complaint by a husband. In this complaint, husband of a pregnant wife explains his experience of routine checkup in a gynecology OPD. The complaint is against the doctor who, after making the pregnant patient wait for hours, transfers the card to another doctor. It takes the pregnant patient another 5 hours before being called by the doctor. The doctor was found to be arrogant by the patient. Made by pregnant wife stand and attended to other patients out of turn, says the husband. In spite of knowing that my wife was advised bed rest, according to him the test was not performed causing distress. When the hospital's grievance cell got back to the complainant, he informed that on the same day the test had been conducted and he was no more interested in the complaint. Analysis. The complainant exhibits acute mental distress by mental noise resulting in a cognitive bias. The inescapable conclusion, however, is that doctors should be counseled and trained to improve their communication skills to handle patients to avoid mental distress and trauma.
7 minutes.
Okay. Then there is a complaint by a blood donor. This complaint was against the doctors in the Department of Transfusion Medicine. Now here the complainant says that her cousin sister, who is a first-time blood donor, is under distress and trauma and is suffering from heaviness in the head, shivering, vomiting, etc., etc. And she says, oh, she's not normal. For 2 days her sister was in the same condition and was unable to join office. But when all this distress and trauma was taken care, when the doctor informed that the patient that her experience, especially as a first-time blood donor, is normal. I mean, first time when you donate blood, you have all these symptoms, and she was the first-time donor. So all her doubts were cleared. Devoid of relevant information, the complainant's psyche exhibits a clear case of cognitive distortion of all the 3 types, namely blaming, magnification, and jumping to conclusion. The lesson to be drawn for the doctors and other staff is to be trained to provide relevant information promptly. And I'll skip some complaints then. There's a complaint by a daughter. The complainant is the daughter of mother patient who was suffering from syndrome but admitted to PGI for seizures. The complainant says that her mother, despite being a patient of syndrome, died in PGI due to low BP and pulse rate. She attributes her mother's death to the negligence, ignorance of doctors on duty, and the wrong treatment ultimately made them helpless. She reminds the authority of their responsibility to look into the complaint. This complaint is solely guided by trauma caused by her mother's death. She exhibits mental noise, making her focus only on one aspect of complex problem, in this case syndrome and autoimmune disease. Owing to a personal loss, the complainant suffers from cognitive distortion and resorts to blaming, jumping to conclusion and magnification. The complainant, when contacted, did not want to pursue the complaint. It can be concluded that timely and prompt sharing of information could have avoided the subsequent trauma and distress suffered by the complainant. This points to the need to sensitize doctors to process effective patient communication skills. There is a complaint by an eye patient. The complainant rejects the report of the medical board, which was given to him at the Advanced Eye Center, that assesses visual disability. To support his rejection, he has provided different yardstick for visual assessment, which is perceived to be the right one by him but is not followed by PGIMER. His abundant cognitive bias is reflected in his refusal to get his eyes checked by another board constituted by PGIMER. In the complaint, it is also mentioned that due to incorrect visual report of PGI, the education department terminated my services, which is a greater loss to me. Now, this type of cognitive bias exhibited by the complainant is old bias, blaming his trauma and distress engendered by termination of his service and poor eyesight. His rigid cognitive bias could be set right only by counseling him individually. Now all this data shows the presence of confirmation bias, hindsight bias and framing bias. The analysis of grievances of patients and attendants showed that patients adopt a very narrow approach and description of their hospital experience, in other words, framing bias. The most effective way to rid them of the framing bias appears to provide them a larger picture of hospital experience, focusing on highest quality of patient care which is given there, inclusive of world-class treatment. Representative heuristics can be used to conduct effective public relations by constantly highlighting, providing cues such as 10,000 new patients visit PGI every day, best incomparable diagnosis and treatment assured. Every doctor attends to 400 to 500 patients every day. Assured world-class treatment at minimum cost and highly specialized doctor experts driven by service motivation. Such effort will alter their judgments based on representative heuristic. These are my references. Thank you so much.